Hi, my name is Marissa Rivera, and today I'll be talking about ischemic colitis. Ischemic colitis is an inflammatory disease of the large intestine, also known as the colon. It's more common amongst those who are over the age of 60. Ischemic colitis occurs when blood flow to part of the intestine is reduced, usually due to narrowed or blocked arteries. The diminished blood flow doesn't provide enough oxygen for the cells in the digestive system. Ischemic colitis can cause pain and may damage your colon. Any part of the colon can be affected, but ischemic colitis usually causes pain on the left side of the abdomen. Signs and symptoms of ischemic colitis can include pain, tenderness, or cramping of your abdomen, which can occur suddenly or gradually. Bright red or maroon colored blood in stool, at times passage of blood alone without the stool, a feeling of urgency to move your bowels, diarrhea, or nausea. The risk of severe complication is higher when you have symptoms on the right side of your abdomen. That's because the arteries that feed to the right side of the colon also feed to part of your small intestine and may be blocked too. Pain tends to be more severe with this type of ischemic colitis. Risk factors for ischemic colitis include age, clotting abnormalities, high cholesterol, reduced blood flow, previous abdominal surgery, heavy exercise such as marathon running, which can lead to reduced blood flow to the colon, or surgery involving the aorta that pumps blood from your heart to the rest of your body. Ischemic colitis can often be confused with other disorders because their symptoms overlap, especially inflammatory bowel disease. Based on your signs and symptoms, the doctor may recommend these imaging tests: ultrasound and abdominal CT scans to provide images of your colon that can be helpful in ruling other disorders such as IBD, stool analysis to rule out infection as a cause of your symptoms, CT or MRI angiography to provide detailed images of blood flow in your small intestine and to look for blocked arteries. This test is usually used only if ischemia is suspected in your small bowel as well as in your colon. Or a colonoscopy. This test, which provides detailed images of your colon, can be helpful in diagnosing ischemic colitis. Colonoscopy can also be used to check for cancer and to see how well a treatment worked. This is a plain abdominal x-ray in a 65-year-old man presenting with acute abdominal pain and the passage of blood per rectum. Note the thumb printing in the region of the splenic flexure and also the proximal small bowel dilation. Treatment for ischemic colitis depends on the severity. Signs and symptoms often diminish in 2 to 3 days in mild cases. However, the doctor may recommend antibiotics to prevent infections, intravenous fluids if the patient is dehydrated, treatment for any underlying medical condition such as congestive heart failure or an irregular heartbeat, and they might recommend avoiding medications that constrict your blood vessels, such as migraine drugs, hormone medication, and some heart drugs. While most cases resolve on their own, if the symptoms are severe or if the colon has been damaged, the doctor may suggest surgery to remove dead tissue, repair a hole in your colon, bypass a blockage in an intestinal artery, or remove part of the colon that has been narrowed because of scarring and is causing a blockage. The likelihood of surgery may be higher if there's an underlying condition such as heart disease or low blood pressure. Ischemic colitis usually gets better on its own within 2 to 3 days. In more severe cases, complications can include gangrene, which is tissue death resulting from diminished blood flow, a perforation in your intestines or persistent bleeding, bowel inflammation, segmented ulcerating colitis, or bowel obstruction, ischemic stricture.